one of the things that I want to do is, you have my record, is I've come from the bottom of the system to the top, which means that I've started as a line worker to a state director. And I had an opportunity to see everything in between in these 29 plus years. And I've traveled across this country and had an opportunity to see the good, the bad, and the ugly of what goes on in our system. And I found myself wondering, how did we get here? And the question to me is always, if it was our children in these systems, what would we do to make things better for them? I worked in Florida, and I worked doing the Bobby M, system, doing the Bobby M time. And it was a good experience when someone else comes in and looks at your system. The issue really becomes, in my mind, do we have the political will to tackle a lot of the problems that we see with our young people and the cost that's attributed to that? What we do in Wayne County, I think we have one of the best systems that I've been able to be associated with. And one of the reasons why that is because we look at kids from a holistic approach. We triage kids who come into the detention facility, because what we found is that we have kids who have mental health issues, medical issues, and health issues. And if a kid is hungry, can't see, and in pain, it's going to be very difficult to educate them. And I think we have to look at those things that are going on in our communities. The statistics, again, is in the testimony, and I won't go through that now. But our data has been very good on kids not returning into the system, or either not moving up to the next level, because we know that the next level is going into the adult system. And when they go into the adult system, the question really becomes, are we really concerned about how much we spend? Because we know it costs much more to house a person in the adult system after they've left the juvenile justice system. And so the issue is, what are we doing about the prevention measures? When kids are coming to school, we talk about zero tolerance. And what I found is that zero tolerance is really, without being politically correct, a lazy person's way of not wanting to work with kids. And we have to understand that. We have to put a lot of effort in to working with these children. And I'm concerned because of my own children and making sure that they have a place that's safe. Because what happens with our kids and what we don't do affects everyone in this room, from our insurance rates to our school, our taxes, and the whole 9 yards. And I think we have to be concerned about that. The reason I'm passionate about this is that I've been able to see a lot. And one of the things that we have to do when we're talking about, we have to funding. No one wants to talk about funding these programs properly. And if you're going to do it, we're going to have programs funded to the point where we can look at the medical issues that are happening with kids. I have kids that come into my institution that can't see. So how do we expect for them to learn if they can't see? I have kids who come into my institutions who have not seen a dentist in the time that they've been on this earth. A quick story: we had a young man that come into our institution. He got into fights all the time. The kids used to have names for him. When we fixed his teeth, do you know that the kid never got into another fight after that? That's what we're talking about here, is really looking at the kids as we look at our own kids. And we would not look at what it was costing first when we're looking at our kids. We would look at what's the best system for our kids. Then we'd look at the other part of it. And I think we have it backwards. We need to look at how we're going to spend our money, but is it good money being spent to turn these kids around and to reduce the recidivism rates and things that are happening, in our systems. And I think that's one of the things that we have to do.